We have a quorum. Let's go ahead and begin this morning's meeting of the El Paso County Public Health Board of Health, May 25th, 2022. And this meeting is being live streamed on the El Paso County Public Health Facebook page. And we are going to do the member roll calls. So I'm here. Commissioner Bremer is excused. Commissioner Lojinos Gonzalez.
Here.
Councilmember Dave Donaldson.
Here.
Dr. Richard Vu.
I'm here.
Fire Chief's excused. Ms. Doris Ralston.
Here.
And Trustee Ron Stevens.
Here.
And General Jack Briggs.
Here.
Great. Welcome. Now in your packet, there is the agenda, and so you would have had a chance to look at that. You'll see a slight modification because we tried to move the action items forward in order to accommodate whoever plans to attend the Air Force game, the Falcons game today. So if that seems okay, we'll just juggle the meeting items a little bit. After looking at the agenda, do we have a move to approve?
So moved.
Second?
Second.
All in favor?
Aye.
Aye.
Okay. Well, Board of Health comments, and I do have a couple of comments, and I wanted to lead off with welcome to our newest board member, Jack Briggs. And Jack is filling Kari Kilroy's seat of a representative from the nonprofit, private, or public education sector. He is currently president and CEO of Springs Rescue Mission, Southern Colorado's largest homeless addiction and poverty nonprofit, local nonprofit. He's also a member of the El Paso County Criminal Justice Coordinating Council and Behavioral Health and Legislative Affairs Committee, and the Colorado Health Partnership Co-occurring Disorder Working Group. And if I might add, Colorado Springs is an extremely military-centric community for lots of good reasons, 5 bases, multiple defense contractors, and a long history of association with the military. Bear witness, our Air Force Academy. And a lot of you here in the room and here on the dais are former military as well. So Jack's a 2-star general in the Air Force, F-15 driver, and his most recent job before coming here was at New York University, and I know I'm going to mangle this, but the vice president for health and resiliency and global affairs. Was that pretty close? Okay.
Close enough.
Okay. There you go. So he got to manage New York University's remote sites and also their student body during the pandemic. So good on you. Welcome. Thank you. You have a few comments for us this morning?
Well, first of all, thank you very much for the introduction and the opportunity to be here. I am absolutely humbled by the opportunity to participate with these other folks and experts, and particularly with the staff of public health here in Colorado Springs and in El Paso County. We're a very unique community for a lot of different reasons, and one of the things that attracts people to this region and of even Colorado is the healthy living that they feel when they're here. But that doesn't just come by osmosis. A lot of it has to do with the hard work of the staff that you see every day. And so I appreciate that. I appreciate the opportunity to serve on the board, and I look forward to meeting everybody and working together. Thank you.
Great. Well, welcome. So I mentioned already the agenda items that require a vote from the board have been moved forward in case some members need to attend the Air Force Academy graduation. Public health champion presentations, of which we have several, and public comment for items not on the agenda, and the director's report will follow immediately after. And just for a heads up, our next meeting on June 22nd will be held in room 1019, which is just down the hall. So it may not be quite as nice as this one, but we'll get her done, and we'll be able to get together in a convenient area. This room was not available. Okay, Other board member comments? Let's start with you, Dr. Vu.
No comment. Thank you.
Jack, anything else, General?
No, sir. Thank you.
Okay. And Ms. Ralston,
No comments.
Commissioner Lohina.
Thank you. I did want to just highlight, prayers for, thoughts for those that have passed away in the very unfortunate situation yesterday in Texas. It's too early to know, but, in some of these cases, mental health, other issues, just something that, of course, we want to hopefully be able to find out what happened and if there's things that we can do, especially if they do relate to something related to public health. But also I did just want to welcome Jack as well. And Dr. Turbush was also involved in those interviews. And I think you saw we had, 5 or 6 outstanding candidates. And so very pleased with the outcomes and the energy. I think we call one of those outstanding candidates the energy that was brought that day was amazing.
True.
So I just want to thank all the public for all the volunteers that we saw. We had outstanding pool of candidates that day, and I hope that they remain engaged and hopefully participate here or in other boards or committees for the city or the county. Thank you.
Thank you. Councilmember Dave Donald.
I would also like to say welcome to General Briggs. Look forward to working with you. And just to add to something that he said about people come to Colorado Springs for the healthy living or the healthy lifestyle, the outdoor lifestyle. I ran 5 miles this morning like I like to do in the mornings on the Santa Fe Trail. Man, the mountains are so beautiful right now with all that snow on it, and a bunch of deer were out there. So that is the best way to take care of your health, is prevent the problems by getting out and exercising. Thanks.
Amen. That's good. Trustee Ron Stevens, please.
Yes, I'd just like to say welcome to General Briggs. I met him Monday, and I think he's going to be a great addition to our board.
Okay. And in your packet, we have the minutes from the previous meeting in April, and I assume everybody's had a chance to look at those. Any corrections or additions? Otherwise, I'll entertain a motion to approve.
So moved.
Second?
Second.
All in favor?
Aye.
Thank you. Finance and budget. Samantha Montmany, did I mangle that? Is that okay? Is that how you like it said? Is he? The emphasis on the wrong syllable? There we go. No? Okay. All right, go for it. And we have slides, right?
Yes.
Okay. There we go.
So what you have before you is the financials for April. As you can see, revenues are still a little bit lower than budget. Those are pretty much in our program-specific grants, which coincides with the vacancy savings that we continue to see. Also, the program licenses, fees, and permits are down at this time, and that's just due to a system issue that should be corrected here in another month. So then on June's report, those should be coming back to budgeted areas. And expenditures, those again are running under budget. Again, personnel, it's the vacancy savings that we continue to see. But overall, we don't have any concerns at this time. Do you guys have any questions for me on financials?
Yes, questions for Samantha on the budget. Dr. Vu.
Hi, Samantha. I can't remember the numbers from previous months, but what I remember is the variance has been in the red for a while, and you had mentioned that you don't have any concern at this time, so that is good. But can I ask you if you remember what the trend has been?
So overall, we have been continuing to be under budget for our revenues, and a lot of our program-specific grants are expenditure reimbursements. So as we don't have those expenditures because of our FTE vacancy savings, that's why we're not seeing the income overall from those revenues. So that's why we, again, don't have those concerns.
Okay. I guess with that, do we anticipate that our expenditure going to increase because we will need more staff in the future, and when we're able to hire them and we need the work to be done? Do we expect that, and do we also expect that our income will also increase appropriately with that?
I'd just like to add a little bit of a context to this, a little bit more detail. we were obligated to transfer to a new system in one of our programs that collects fees due to licenses and permits, our environmental health section. And so you'll see that it's pretty significant there. The process kept on being delayed as it relates to invoicing. And so invoices have begun to go out last week. And so that should catch up. And I think it's around $700,000. But that's pretty significant when we talk about retail food establishment licenses and permits and fees. And also note that our agency does not have the ability due to certain laws to keep all of those fees that we collect for the retail food establishments. That's set in statute, so we do send a portion of those funds back. As Ms. Montanmi had said, that staffing and vacancies, that continues to be a challenge for us, and that's a challenge that the rest of organizations are facing in our area. And when we talk about public health and the challenges that we faced in COVID and maintaining staffing and resiliency and all those aspects, those all contribute to it. We should be getting caught up. And as our grants come in and as we invoice the state or the grantor to get reimbursed for those grants, those are also a little bit behind as well. So we should see some catch up. I would anticipate by next Board of Health and then so on. We should be catching up, and I appreciate those questions. Thank you.
Thank you, Susan. Thank you, Samantha.
Good questions. Any other questions about finance and budget for this month?
I have a quick question. What type of reserves do we keep on hand?
Good point. Good point.
So we do have a policy on that, and the board establishes that policy. And I believe it's 3 months of operating, which is a standard. So that's the standard there. And Sam, you can talk a little bit about what that looks like. But we do have a target goal of 18 to 20% of our budget.
So the fund balance that you're seeing on the bottom of the screen, that's the 18 to 20% that we try to keep our fund balance to. And the 18 to 20% is based off of our annual budget. At this time, we are definitely seeing that 18 to 20%, and it's slightly increased. So
I'll also note, we're going to talk about our annual report in 2021. We did see some significant contributions to the response for COVID, whether it was American Rescue Act dollars or other CDC grants. And so that's also contributing to some of what you're seeing here, because usually our budget is around $17 million, and we're managing multiple grants on different timelines and trying to move staffing, and there's many moving parts with that. Commissioner Gonzalez?
Oh, I was just going to say, so over the last, I don't know if it was last year or 2 years ago, we had built that up to such a level we actually wanted to spend down a little bit of the reserves to get closer to the recommendation, because we had a very good, strong reserve in place.
And I guess just as part of, adding to that there, the board did decide to keep $500,000 in reserves for emergency response, and that was the area that helped us move pretty quickly.
Yeah, that was our carve out. That was our rainy day fund, if you will. Any other questions about April financial summary? We don't actually have to vote on that one. No? Okay, but we do get to vote on the next one. These are 4 contracts, and I understand that there are 3 renewals and 1 new one. So if you could go ahead, Samantha, and let's take those individually. Okay, please.
not a problem. So the first contract is the Immunization Core Services contract. This is, we have a very slight increase, about 5% from last year's contract, but it is one that is ongoing. Any more specific? I can go into further detail.
We've all had the chance to look at them. Any questions about the first contract? Immunization Core Services funding. Okay, let's move on.
So the next contract is the nurse home visiting program. This one is also a very slight increase from last year. And again, this is an ongoing contract as well.
They changed the name on this one, didn't they? No? Okay. This is not the same as nurse family.
No,
Partnership.
it's nurse family partnership.
Partnerships.
You might be thinking of the nurse visitor program, which Peak Vista has.
Okay. All right, and number 3?
It's the public core service funding. This is the state funding that we receive. So this one, it's an ongoing contract. The amounts kind of changed, but it's just kind of where the funding is coming from the state, and the way in which they have handled it.
Okay, and just for the benefit of the folks in the room, a bi-level description of what it's about.
So this is our core funding from the state that they provide to us to provide public health services.
So we're capitated. That's
Yes.
okay. So part of the money from the state that we receive is based on our population,
Yes.
and that varies somewhat year to year.
Yes.
Okay.
And this does have the increase that we started to see last year.
Okay.
I know Susan and their team has been very diligent on increasing this funding from the state for us. And so this will be an ongoing of that. Last year, the funding was in some ARPA funding, and this year it is into the core funding itself.
Great. Since we're the most populous county in Colorado, that's a big deal.
Well, I'll add a little bit to that. So our Board of Health, some, members that have been here for a while, and we have new members, we have went before the Board of County Commissioners to get some critical needs funding for some full-time employees and positions that our agency and community needed, which came to be really helpful for the COVID response as well. And that's, one example is that we created a Office of Data Analytics. The state's funding had been stagnant, I believe, for around a decade. So when you talk about over $900,000 to invest in core services for a population our size, that's not going to get you very far. So the efforts of advocacy to reach out to the state and get some increased funding occurred, and that's what you're seeing here. It's for 3 years. The first year, they're using the American Rescue dollars, and so there are certain requirements about that, and I know that our finance department and budget department, I mean, they have really been scrambling to meet all of the criteria because it's not flexible in the sense. I mean, there's a lot of requirements that go along with that. And then the next 2 years will not be ARPA funding. It'll be general funding. But all of that, as you see in the synopsis, it's used for core public health services. And the core public health services is defined at the national level and then the state level. And then that's what you're seeing here, that those are the basics of public health and what we should be able to provide to the citizens.
Anything out there on the horizon about perhaps raising the capitation for citizens of Colorado?
I'm not aware at this time. When we talk about per capita, sometimes our agency does benefit because we have the most populous county, but there are so many different funding formulas when we talk about different grants. This is a grant that they did use some of the population-based funding, so we are one of the counties that have seen the highest increase, but also that there's no guarantee that is going to go on, and we're already almost through the first year related to how the state funding works.
Okay, any other questions about number 3? Public health core
Dr.
funding.
Terbush,
Yes, please.
real quick, new guy question. So is it possible to get a copy of this annual report? Can I get that? Appreciate it. Thank you. The second one is, and I think you answered it, but I just want to make sure I heard it, Director Whalen, is that the ARPA dollars are going to, for this the FTE positions that are being created are only for the first year. And then the out years, there's going to have to be other funding for those FTEs. Is that correct? Is that what I heard you say?
Not exactly. So
Okay.
the first, well, So the funding we can use for staffing, and Sam, you can go into what else it can be used for. But yes, the ARPA funding for the first year is in effect, and then it will go to the state's general fund for our state per capita funding.
So we see a pathway forward. We're not just assuming a cost based on the fact that we've got these extra dollars for the ARPA money right now, and then we're going to have to figure it out 2, 3 years, 4 years down the line because we have new FTEs. There's actually a pathway for after the first year. Is that correct?
So for years 2 and 3, the state has is the general funding that we had spoken about.
Okay.
But after that, that's when we're going to have to come up with the plan or work with the state on continuing the increased funding
Okay.
for public health.
All right. So we're talking about a 3-year sort of baked in thing, and then after that. All right. Thank you.
Well, and I would say also to keep in mind that our budget is made whole through so many different moving pieces and grant funding and county funding and state funding that it is always a work in progress related to what our actions are. We're very persistent and aggressive in seeking grant funding as long as it meets our goals and objectives to what's important to this community. So it is an ongoing effort that we're trying to always make whole because the majority of our funding comes from grants and contracts. And as we know that those are specified for specific requirements and you can't go outside of those requirements. And so sometimes they don't meet the needs of some of what we can do with the core funding.
And I look forward to understanding that better as I go forward. Thank you.
And
you.
Dr. Turbush,
Yes.
we also have talked maybe about looking at increasing fees for our services so that we can help be more self-sustainable in the future. And I think that will help. And then we've also talked about looking at some other funding sources, perhaps the city.
Yeah, I think that's important for people to understand that the budget of the El Paso County Public Health Department is approximately 20% and 80%. And the 80% comes from grants and programs. And so things that affect our budget a great deal. But there is the opportunity, as Mr. Ralston mentioned, to maybe conserve and find a few extra ways to save some dollars and so on. And I know Susan and her crew are very conscious of that. And find Jack, you had mentioned, General, you had mentioned the copy of the annual budget, which we can certainly provide.
This is actually a different document, I think. This is a response to a report that goes to the state on the ability to deliver core public health services. It's the last line in the first paragraph. Somebody could just help me figure that one out. That'd be great. Thank you.
Okay.
Samantha,
Dr. Turbush, there's a couple of comments,
Okay.
Mr. Donaldson and Dr. Vu as well.
Okay, please.
It's a question. Thank you, Susan. Get back one page on the nurse home visiting program, which, just reading through this synopsis, it impacts 200 families, and then it's 1.3 million. And the goal is to improve the health and life course of low-income first-time mothers and their children. And then it has 3 important goals: improving pregnancy outcomes by helping women in their health-related behaviors, improving child health and development, and improving families' economic self-sufficiency. And this is a renewal. How do we measure the success of this? I mean, how do we decide, hey, this is effective, let's keep funding this? Or, you know what, these 200 families have the exact same outcomes as the other 500 families near them that don't do this, and our 1.3 million, we could use it more wisely somewhere else.
I appreciate the question. I'd like our Health Services Director, Brenda Heimbach, to come up. And this program, this effort has phenomenal outcomes. And so we can do more of a presentation at a later time, but maybe, Brenda, you can help us maybe with just some high-level answers to Mr. Donaldson, because this this is like a gold standard related to outcomes and the work that is being done in this program.
It really is. It's an excellent program. We have decades of research. It's an evidence-based program that shows tremendous outcomes that last, in some cases, throughout the lifetime of the children. So it's for first-time low-income moms and their infants up to the age of 2. And they have a nurse who comes to their home and works with them in different areas. The outcomes include reduced accidents and infant death, moms that return back to work, things like that. So it's a tremendous program. The reason why it's capped at 200 families, it's very structured. There are a lot of rules and parameters around this program, how many nurses, the ratios to clients and things like that. And the nurses spend a lot of time with these families. So that's why it's 200 people for 8 nurses. But it's an excellent program. So if you're interested in more information about that, we'd be happy to present that.
I would, and if the other board members would be interested in it, then maybe it is something that could come before us, simply to see some of those ways we do measure that. Because it sounds like a good idea, but lots of things, they sound like a great idea. But then when you compare, okay, how did these 200 families turn out compared to 200 that weren't involved in the program? 5 years later, everything's exactly the same. And then maybe, we just need to evaluate what we're doing. How can we do better? But I really look forward to that.
Yeah, it's a national program. Dr. David Olds has done tremendous research. It's very well done research as well that does show a difference in the families who receive this program and the ones who don't.
Yeah. How far out do they look at those results? Is it during these 2 years or is it 10 years later?
Beyond, they do some longitudinal research on that. I'm not quite sure where they cap that exactly, but they've done some longitudinal research as well. And then the program is also available in other countries, and they track outcomes for that as well. But it's quite structured in terms of how they structure the outcomes and measure that.
Yeah. And how long have we done it here?
Quite a few years, yeah.
Yeah, I've been here 20 years, and we've done it for a very long time.
Yeah,
Yeah.
Councilmember Donaldson, I did a deep dive on this program several years ago when we had medical students here, and we actually went with some of the nurses on the visits and accompanied them to see how it was impacting these families, and it really is a feel-good story. I would encourage, if you have time, maybe some of the photos and the individual stories of families that this program has affected. I think that would be very encouraging for the board.
That'd be
to
great.
See.
And we
Great
try
program.
to include some of that in the Board of Health reports, too, to
Okay.
make it come to life, so it's not just statistics.
Good.
Yeah.
Thank you.
Thank you.
Thank you.
Dr.
Okay.
Terbush, I'd like to make a comment, and that is it's very upstream and prevention-oriented, and that's really critical in helping these young children, young infants, be healthy and productive citizens along the way. So it's part of what the Board of Health and health departments in general want to try and achieve is these upstream programs to do the prevention.
Good. Dr. Vu?
Yeah.
Nope. Okay. Let's move on then to the fourth one, which is a new program, right? Go ahead and spend a little time with that, please. No?
Actually, I believe
Did I
this
get
is
that
a
wrong?
renewal
Okay.
as well. Sorry.
Okay, go ahead.
So this is the shared risk and protective factor approach to substance misabuse prevention. This is an ongoing contract. The amount is the same as last year. This is using marijuana tax cash funds to improve the health of Coloradans by reducing substance misuse among youth.
Okay. Any questions about this one? This is use of marijuana tax funds to help prevent substance abuse.
Yeah, I have a question on, actually, there's been a few of these programs that have the line item indirect percentage. Can you explain what that is?
Yeah, on a lot of our grants, we're able to claim what we call the indirect percentage. So the grants themselves will pay for the direct cost of the staff doing the work for the grant, but a lot of times they don't allow for costs to pay for the building, the meetings, everything else that goes into these grants as well, because they're not direct, so that's considered an indirect, and that's the indirect rate that we're allowed to charge on those grants to help offset all the other cost. So it's for my time standing here, it's for all of these, Susan's time, anytime we're reviewing these contracts, these kind of things to help offset those costs as well.
For finance, for IT, for HR, and the state health department has an agreement, and we're able to charge what they allow us to charge for indirect costs.
So is that reimbursed to us?
Yes.
Okay,
Yes.
thank you.
Good question.
Good questions all.
Dr.
Thank
Gerber.
you. Yes, please.
So first of all, I want to say how important I think that this particular effort is. At the rescue mission, obviously, we see a lot of substance abuse. A lot of that starts in our clients' early years, and so addressing the early years and trying to have prevention early is good. I do have a couple of questions, though, and it's these sort of phrases that you may hear me ask questions about. It says in the middle of the paragraph, drive decision-making during the scope of the project, grantees can expect to see reductions in risk factors and increases in productive factors. So how, not for now, but measuring those, again, it goes back to what the councilman said, is that how they're measured, what's being measured, and then how it's measured, I think are important factors to maybe tease out maybe in a future. And then the strategies all start off with build public support. And so I would ask, maybe a little bit more fidelity on what that means, build public support, because that's a sort of a squishy term, right? So could you just address that a little bit, maybe?
I'm going to phone a friend.
Okay.
Okay.
I'm your friend. So I would like Heather Graves, our Community Health Promotion Division Director, to come up here. I think that these are really great questions on upstream prevention and how do we measure it, because I do think it's critically important that we that we are good stewards of the dollars that we are receiving. And this is another program that we have to follow to fidelity in order to get reimbursed for the funding. And this one has tremendous outcomes as well. Some of the challenge I think about prevention programs that is hard to understand, and I'm not for the board, but maybe for the general public, that it's a long-term investment before you start seeing some results and some sustainable long-term results. But when I heard about what happened yesterday, also in Texas, my mind goes to risk factors also, and the community and how it's set up and the connections. And I think what might be valuable and interest of the board is that we present on Nurse Family Partnership what that prevention model is and what the outcomes are, and then we also present on communities that care. And really kind of dive into some of that detail and how those work, because those are really gold standards on what the work we do and how that relates to prevention. All of this prevention program has to have the community support. And I was one of the ones years ago to initiate and advocate for this funding. But in order to have the funding, we had to have partners and leaders that were committed and involved. And Commissioner Gonzalez was one of those leaders. And we chose the town of Fountain because we were trying to work in so many different areas. You can't do a blanket prevention program and realize some results. You go down to the zip code or you go to communities and then you mobilize the community and you get that engagement, because it's not a health department siloed work. It's a multitude of factors related to the public health system and how we contribute to that. But this program specifically is in the city of Fountain, and I was impressed when we were reaching out, trying to get some of that investment. And in the investment, it's not dollars with some of our partners. It's their time and their expertise and their commitment, because they are the leaders of the community. So we had Chief Heber, law enforcement involved. We had the superintendent, from some of the schools involved. We had the entire Fountain City Council involved. We had the mayor. We had and who the chambers, but it wasn't because Fountain City sees more youth substance use. It was because we chose that area because the leaders were ready to really engage and to help us, because the health department is not going to be successful doing it alone. So I think that this program is another gold star that is a benefit to the community, and we'll be able to demonstrate some results. But Heather, if you wanted to add to that,
Yeah,
I welcome your comments.
I just, you covered it so well. The protective factors is really increasing those parental involvement, community involvement, school involvement. Risk factors are, kids that are alone have access to substance, whether it's prescription drugs or marijuana. And so it is a community coalition that comes together where public health is the backbone. And talking about building support, it's that readiness and willingness to come together with a shared goal and leveraging the readiness, the leaders in the community and their position, and the different community-based organizations that are involved as well, like the YMCA, the library, some of the religious churches, or churches, and a religious faith-based sector is what I'm looking for. And in terms of measuring the, I've been here I think about 8 months now, but this program I believe was formed around 2015, and so some of our measurement, we collect data, we do surveys, and I'd be happy to come and present in more detail as well. But a lot of the conversation we've had recently around substance use and abuse and concern, those efforts are taking place in the Communities That Care grant.
And I'd say also, our approach is not, we don't go to communities and say, we know how to fix your problems. We come to communities and we want to collaborate. And the phrase that you might have heard is nothing about us without us. So in this specific situation, it's the youth that has a coalition that they're driving also in the evidence-based model, but they're driving to make change. So it's really mobilizing the people in certain communities to look at, what identify, what areas of problems, and then prioritize, how are they going to go about implementing some of those prevention models, and then just building that over time. But I think that is really important because, again, the health department is not successful alone. And, keeping in mind whether it's the homeless population or, any population, they want to be involved. They want to have a voice. They want to partake in those action steps. And this is a model that certainly walks that talk.
I will add really quick that there is a youth action board that's a part of this, and they've won awards for their work, really set a model for this program in the country and in the state. And as Susan said, they're involved in at the table, and a big component is childcare, safe space for youth, and again, parent and family and community involvement.
Really good discussion. Let me bring it back up here to the dais one last time. Any board member questions or comments on any of the 4 contracts?
Can I
Yes,
have one
please.
comment? It sounds like this program is such a wonderful program that's needed in our community. Can I just say that it's a little bit funded? It's funded by the marijuana tax money.
Noted. Okay.
And then Dr. Purse, just my final, it's really a request. If the other board members think this would be useful, personally for me, it would be very helpful to receive a presentation on each of these 4 programs, with also an explanation of, okay, and this is how we measure our outcomes on this, so that I can feel good about not just approving this funding, but okay, I see this as effective and we've done it for this many years. This is the impact we've made. Or we can't measure these results until a certain point. That would be very helpful for me. So if others would like that, I think that'd be great.
Yeah, I would agree with Councilman Donaldson. I'd like to see a presentation. I know it's a lot to do in one session, so but if it were presented like the meeting before, and then the budget request would come, or the renewal of contract would come up, then we'd have a better idea of how effective the program is. And also, one more question I have: are these items here already have they already been budgeted for, or are these outside in addition?
So these funds are anticipated and included in our current budget.
However, that's with Board of Health approval. If you don't approve the contracts, it doesn't go through, and the anticipated budget is no longer. So they're not in effect until this board approves it.
Seems like a two-step process to go ahead and approve these today based on the information that we've provided, but that for future reference, we could take them maybe one at a time and explain and show the outcomes. And because I think it's the core services of our health department, and I do remember going through each one of these programs. So I have familiarity. I think it would be good for the rest of the board members to have familiarity. So any members of the public who wish to make a comment on these contracts? Here? Not seeing any? Okay. Well, I think we've had quite a bit of discussion. I'd like to go ahead and take them as a group. And do I hear a motion to approve these 4 contracts?
So moved.
Second.
All in favor?
Aye.
All right, good job. I think we are through the action required items, so if somebody needs to split to go see the Air Force Falcons win a football game, that's that's perfectly okay. All right, Susan, I think.
The graduating great Americans today.
Yes.
Yeah,
Yeah.
I wanted to add and acknowledge, I mean, a congratulations to all of the cadets. And then we also, I learned, we've got 2 board members who are previous cadet grads on our Commissioner Gonzalez and also General Briggs. So I think that's pretty outstanding as well.
There you go, ring knocker. Good job. Okay, Director Whelan, I think you're up.
Okay. Now we're going to shift to public health champions, and we've been recognizing many public health champions. As I said earlier, that we cannot accomplish our work in a silo, and we can't accomplish our work alone. What makes it successful is that we have numerous different community partners and stepping up to help, realize certain efforts that are needed in our community. And this is just by chance. I had no idea that General Briggs was going to be a Board of Health member, and it's very interesting on how things work out because this is his first day, and his Springs Rescue mission is going to be recognized along with some others that have helped develop and respond to protect the homeless population with isolation and quarantine. So I am going to read a little bit of what was accomplished, and then I will ask some of the partners to come up and join us. And also, if you have any comments that you would like to add for your outstanding work and how that all worked out, and then we will take a photo with the board later. So with that, let me go ahead and read a little bit. And if you could come up here and stand with us, that would be great here up the podium. We have Jennifer Mariano, who is the Director of Programs for the Community Health Partnership. We have Andy Phelps, who is our Homeless Prevention and Response Coordinator for the City of
There he is.
Colorado Springs. We have Jack Briggs, General Briggs, who is the President and CEO of Springs Rescue Mission. And we also have Mark Wester, our Executive Director of ComCore. We had other partners, too, who contributed to this. So this is no way in reflective of the whole. We have the Pikes Peak Office of Emergency Management, and we also have our response team who helped initiate and in this effort. So people experiencing homelessness are among those that faced and continue to face the most severe consequences of COVID-19. In the early moments of the pandemic, it was noted that people experiencing homelessness would have difficulty following the public health recommendations to have access to clean masks, practice frequent hand washing, and observe social distancing. It would also be difficult to have ill individuals in shelters without exposing others to COVID-19. The homeless quarantine and isolation shelter began operating at the Colorado Springs City Auditorium on April 5th, 2020. And if you remember, we started seeing cases in early March. The Community Health Partnership, the City of Colorado Springs, and the Springs Rescue Mission spearheaded the efforts to open the shelter in just a matter of weeks. Overcoming obstacles and following this project for 14 months was truly a testament to the incredible dedication these individuals and organizations have for this population. The shelter at the City Auditorium remained in operation until June 2021. When these services transitioned to a smaller facility, in August of 2021, it became apparent that the needs for quarantine and isolation surpassed the current capacity. And Andy Phelps worked with Mark Wester of ComCore to stand up City Hope, which remains in operation. Previous planning and community partnerships allowed for this facility to open within days of the identification of need. City Hope can currently accommodate up to 100 residents in quarantine or isolation. And ComCore provides a physical facility, meals, and day-to-day operations. As you recall, probably the dynamics were changing very quickly. We didn't have the complete picture of all of the information, and we would get information at different times. And this group right here, and also Dr. Johnson was integral in that effort as well, worked tirelessly to ensure that the homeless population would be protected. And I think your work has been outstanding, because part of prevention is what doesn't happen. And sometimes it is hard to have tangibles or some of the numbers on what you did prevent. But I know that there was a tremendous amount of prevention, because had you not responded quickly and set up a place for the homeless population, there would be many, many more cases of COVID-19 and spread. And that not only impacts the community, it impacts our hospitals. I mean, there's so many links to what could occur. So with that, I'd love to hear any comments from you all, and then also hear from board members about this public health champion. I have some coins for you and to give you. And then I also have some public health champion awards. And I would also like members of our team, because I know that many, if you hadn't worked with them directly, or Deanne served as our emergency center coordination. So there were so many pieces of trying to get the funding and the space, and so many conversations that, weren't on the typical Monday through Friday, 8 to 5. I mean, you guys were really invested, and we're tremendously thankful for your efforts. So Jennifer or Andy or anyone want to start us off?
Thank you for the recognition and the opportunity to be able to recognize, I think, all the other partners that didn't have an opportunity to come today as well. It was truly, truly a joint effort with many folks working a lot of hours to make this happen. And I think it's pretty impressive that, over 2 years later, many of us are still working together and friends and still friends. Yeah, exactly. Because every time we heard the insurance isn't going to cover that, it was like, great, here we go again. Yeah. So I think it's a testament to our community and the commitment specifically to individuals experiencing homelessness. So appreciate the opportunity to be recognized, and all these amazing people as well.
I just wanted to say there's a lot of other city employees, obviously, that were involved, so I'm sharing with all of them. But I wanted to say that I remember vividly March of 2020, the anxiety I felt with COVID and what's going to happen if that gets into our homeless shelters. But I'm just really proud of the work that city leadership did with county leadership, our health department, OEM, continuum of care. And it just goes to show that what great things can happen whenever the community comes together and works on a difficult subject like this. So it's an honor. Thank you.
Yeah, I'd mention too, Brett Waters, who is now the county administrator, was integral in this effort too, because he was part of many of those conversations and trying to get funding.
Good morning, and thank you. As Executive Director of ComCore, I'm honored, and we're honored to be recognized. I'm mindful that to do something like this, you have to have great staff and great partners, and surrounded by many of them and some that aren't here. I really want to recognize that ComCore staff that helped stand up City Hope very quickly, much faster than we anticipated. And we're just very honored, and it's a privilege to serve the community and meet a need. And I appreciate the partnership with the city, Colorado Springs as well. Thank you.
I just want to say thank you, first of all. This is surprising for me, but this is great. There's three groups that I'd like to recognize. The first is the staff of public health here in El Paso County. At the rescue mission and with all of our other partners, we needed that expertise and support as we went through this. And also understanding the sort of the ethos of El Paso County and how we were going to do things. It was a great partnership. And so I just wanted to thank you for that. The second is leadership. I think whether it's on the board here or with the individual organizations that you see, one of the unique things about El Paso County and Colorado Springs is how well we work together. We don't always see eye to eye on everything, and that's okay. But when we need to do the right thing, people come together and do that very well, and that's about leadership. It's about putting pitchforks down and figuring out what the best thing is to do. And the last group I'd like to recognize, and Natasha was not brought up here, but she should be. She's a great representative of the people who actually do the work. We're going to take credit for a lot of it because we're leaders, right? But it's the folks that actually do the work and solve the problem on the ground. And that happened over and over and over again, where I would be presented with an issue and somebody from my staff or your staff or one of the other organizations would say, hey, I think we can figure this out. But that happens because of folks like her. So thank you.
Any other comments from anyone? Lisa, are you online, or any board members?
Director Whelan, I'd just like to say thank you to all of you. And I'm reminded of a quote that says, not everything that counts can be counted, in the spirit of prevention. So thank you again.
I was impressed with how quickly it came together. When it was first discovered that COVID was in our community, to have the homeless population specifically recognized as a population at risk, and then the efforts that went into the homeless shelter happened to me seemingly overnight. It was a great response and very rapid. So thank you.
Hi, Susan. This is Lisa Powell.
Lisa, we can't hear you.
Lisa, you're on mute, I think. Still on
my
mute.
mic open, but
Still can't hear you.
Up.
not working.
Sign language? Nope. All right.
Not working.
Lisa's
There you
our
go.
emergency preparedness and response program
Okay.
manager, and I know you all know her, and she wanted to also say a big thank you for the effort, and those we're going to be part of her comments. So I can't hear you, but that's
We got
I'm
your
reading the mic.
vibe, Lisa. Yeah.
Can you hear me now?
A little bit.
Okay. Jared just said try again, so I was trying again. Mostly, I just wanted to say that I remember back in the beginning, lots of late night phone calls and lots of weekends where we were trying to solve one problem after another, or one obstacle after another. And I can't say enough about this group of partners who came together really to look at how we were going to strengthen community resiliency. And this really was a clear example of how public health gets done by the whole public, not just by this agency. So thank you all so much for the work that was done.
Thank you, Lisa. Good.
I don't see any other comments, so let's go ahead and recognize you guys. And if you're okay with it, Natasha can come up. We're going to take some photos. We're going to take a group photo with all of us in the board, and then we can take each, or whatever Michelle, our public health information officer, wants to do.
Oops, here, I'm going to.
Like in the middle. I was like, they're like.
Together.
Should be good. All right, so we'll just go over here.
Thank you.
Thank you so much.
Thank you very much. Andy, we had well back. Thank you. Yeah. Okay. Moving right along. It was nice. Number 7 on our agenda is any public comments on items not scheduled on the agenda. Any members of the public who wish to comment about items not on the agenda? And I don't see any. So director's report. I got to tell you, this director's report is all over the world. We've got everything from baby formula to monkeypox. So, and there's slides to back it up. So, Brenda, are you up first for baby formula? Or Susan, do you want to introduce this?
Sure. So there are a few topics that have been in the news lately, and rest assured that we're always monitoring and keeping track of what's going on in our community. So I have asked Brenda to give us some information. We have a women's infant and children program, and she can offer how we have been involved in helping infants to and families to get formula, and just what occurred, kind of that timeline and where we are today.
This is working great. Good morning. I'm Brenda Heimbach. I'm the Health Services Division Director. This morning we're going to talk about the formula shortage. Do I need to get closer to this? Okay. The formula shortage, and also our Wic Mobile Services, which we're very excited to discuss this morning. Before I do that, I thought I would just give a brief overview on WIC, the Women, Infants, and Children Supplemental Nutrition Program, as not all board members might be as familiar with that program. This is another evidence-based program with wonderful outcomes, such as fewer infant deaths, reduced health care costs, and improved birth outcomes. We have educators and registered dietitians who provide education on nutrition, as well as issuing nutritional benefits for low-income pregnant women, postpartum women, and children up to the age of 5. We also have a wonderful breastfeeding peer counselor program. We've received USDA Awards of Excellence in 2018 and also last year, 2021, on the quality of this program and the impact that it makes on assisting women with initiating and maintaining breastfeeding successfully. We also have a breast pump loan program, which helps women increase breast milk quantities, which is really important. And so our WIC program has been extremely involved in trying to help families with responding to this formula shortage that we're experiencing. It's important as we talk about the situation that's impacting our nation, our state, and our county as well. And we need to always keep in mind how this is impacting families. A lot of families are experiencing frustration, anxiety, fear about how they're going to find formula for their babies. And so national efforts and local efforts are really important to help families with trying to address this situation. It was caused by a combination of supply chain issues as well as a major manufacturer, Abbott Nutrition, having a voluntary recall, and then subsequently the plant in Michigan was closed. The response to this is other manufacturers are increasing production, which has been helpful to have different types of formula. Several retail store chains have placed purchase limits on the quantities that people can buy at the stores. This, of course, is intended to reduce panic buying and allow more folks to have access to formula. Unfortunately, it has the unintended consequence for lower income folks that they have to go back to stores repeatedly, and with high gas prices, that can be a bit of a hardship. We're trying to work that in with work schedules and so forth. FDA announced on May 16th they were going to increase flexibility and prioritize manufacturers to quickly evaluate whether existing products can be used safely and meet nutritional needs. FDA has recently spoken of their staffing shortages, and they're trying to prioritize how they can get formula inspected and out safely to the stores as quickly as possible. On May 18th, the Defense Production Act was invoked. This is not a new act. This has been used quite a lot since 1950. And in essence, what that means is the ingredients that are needed to make formula are being prioritized for the production of formula as opposed to making other products. And then Abbott Nutrition and FDA, as of last week, are now working together to reopen this large Michigan plant. However, it will still take an estimated 8 to 10 weeks to get formula back on shelves. You all most likely heard on the news that the United States flew in formula from Switzerland. It's a hypoallergenic specialty formula that's primarily destined for hospitals, but that has been helpful as well to at least get some different stock, and this has been authorized as safe for use in the United States, so that's been helpful as well. What can we do to help these families that are so frustrated and in some cases quite distressed? Parents are encouraged to work closely with their healthcare provider to find out what formulas are safe for their children. And in the past, that one type of formula might have been recommended, and now at WIC, we're asking for, when physicians send in that physician authorization form, to please check multiple formulas that are in the same categories that would be safe and appropriate for babies, so that if one type's available earlier in the week and another type's available later in the week, that we can really be very agile with our families in WIC to help them switch their food benefits and be able to take advantage of what they can find in the store. USDA just recently changed can size authorization for WIC benefits. WIC is extremely structured, and only nutritional foods can be purchased, not potato chips, which is one of the reasons why WIC is quite supported. And also sizes of food is determined by WIC. So having that flexibility for families really helps reduce their stress when they're at the store to be able to find something that's going to work for their children. According to the American Academy of Pediatrics, caregivers should not use homemade formulas or dilute formulas or use expired formulas. This can result in severe health consequences. Unfortunately, we're aware that these recipes are going around the internet and so forth. So a reputable website from the American Academy of Pediatrics is the healthychildren.org website, and it's updated frequently and has really practical solutions for people. If they can't find formula in the stores, what can they do? Maybe for a day or two. The options are broader for children that are a little bit older, about a year old, as opposed to small infants, but giving really practical, safe tips for people to use if they can't find formulas in the stores.
Oh, please.
Thank you. And that was my concern, because I'll be honest, I've seen this, do not use anything except formula. What if right now we had no formula? What would people do, right? Because they're told they can't use anything. That's what it looks like to me, and I've got no idea. I'm not a parent. But my concern is people are being told you can't use anything. And if we had no formula right now, shouldn't they get information on what is the best option?
Exactly.
You should be discouraged from utilizing it, but there's families out there, I bet, that have nothing else, and I don't want them to go to the web, the www, and find terrible ideas. Sure. We should be at the forefront of telling them what they should be if they have to use an alternative. This is what you should be using versus, I'll be honest, I think they're being forced to go out there because they're being told you can't use it, and we're doing it here. So that's a concern of mine.
The
second
healthychildren.org
paragraph.
website has a lot of tips. We have a section on our website that has helpful information. Families, caregivers are encouraged to contact stores to find out what they have in-house, maybe before they go. That could save them a trip. There is formula, but it's frustrating because it's not the same formula that they're used to using. So there are options and efforts, of course, to try to get that information out to families. Families are frustrated and they're scared. They're having a really difficult time finding formulas, and we need safe options for children. There have been cases where infants have been hospitalized because of some of these recipes or over dilution.
Brenda, I don't see it up there, maybe I missed it, but a number of moms can bank their breast milk, and that's available also.
Correct. There's a breast milk bank that can be available. It can be a little expensive, so then that's a little bit harder for low-income women. And then also the breast pumps, if women are interested in breastfeeding or increasing their milk supply. There's even relactation, which is something that's being discussed quite a lot. And that does take time, but there are some options as well if women are in a position where that's an option for them. And so we've done a lot of that at WIC. We have that breast pump program. We have hospital-grade breast pumps that we can loan that really help increase breast milk supply. However, being mindful that that does take a little bit of time to be able to bring about. Yeah, it's a very serious situation, very concerning, of course. For WIC clients, they can call WIC and we'll try to help them find where formula is located in stores. For specialty formulas, there are some pharmacies that have it, and at times we're able to order that for them. So while WIC doesn't distribute or obviously manufacture formula, we try really hard to be able to connect people with where formula is located and try to order those specialty formulas if they're available in some of the pharmacies. Other questions about this very serious?
Yes.
So do we have a sense of the shortage in El Paso County? Is it extreme? Is it moderate? Is it what level are we at?
The information we have is that we're experiencing what the rest of the country and the state are experiencing. So at times a type of formula will be present at the beginning of the week and then it won't be available any longer, but another one is available. So we really try to, with our WIC clients, to help them find where the formulas are located. And if the doctors will fill out the forms that check several boxes of different types of comparable formulas, that's very reassuring to families of what is safe for their children, that even if they can't find one that they're used to, that this one's very comparable and safe for their children. And that helps reduce some of the anxiety and also open up more options for them to be able to find the formula.
Okay. So if it sounds to me like we've got sort of brewed at the bottom level here some type of response. Is that being communicated in any way? Is that going out to the media? Is it going out to centers? This is what public health is saying about things like the bottom line for formula is not the label that says your favorite kind. You should be looking for these sorts of things in the formula, in the ingredients, to make sure that it's good. Tangible things that moms can sort of latch onto. And so how is that being communicated?
Did you want to address that, Michelle? We do have information on our website with links that go to different FDA sites and so forth. The healthychildren.org is referenced.
I guess I'm talking about being a little more proactive and pushing.
Yeah, let me go ahead and address that. So yeah, I'm hearing Commissioner Gonzalez and also General Briggs on the proactivity that you are asking for. So the State Health Department is actively working with all of the providers in our community, and they have asked, and correct me if I'm wrong, Brenda, but they have asked that they be the lead agency, because I was asking some of the same questions. What our area that we've been really focusing in on and being proactive, and correct me if I'm wrong, Brenda, we have about 13,000 clients in our work program. Is that fair to say? Or
yes.
So
on the average.
That program is for 0 to 5 years old, and I'm not sure what percentage of infants we have in that program. But part of what we are always proactive on, whether there is an infant shortage or not, is that it's a supplemental program, and we do promote heavily breastfeeding, and now that doesn't work for everyone. And so my understanding is that we have had numerous calls with our client, and this extends also to the Nurse Family Partnership, and anywhere we interface with our clients in trying to help them, because some of the basics of what Brenda had said is that, with gas prices and an individual driving around from store to store and trying to find infant formula is really not a good plan. And so what we have been doing with our clients is trying to actively help them determine where that formula is and to get it to them, or other options. But we are not in the direct service related to providing specific information to individuals' mom, and they do have a care provider for that, but we do have our clientele that we are addressing and that we are being proactive with.
Yes, and the Colorado Department of Public Health and Environment has asked to be the media contact for this formula shortage throughout the state. So, and then we also have information that we've put out as much as possible, and we work very closely with our WIC families.
Dr. Vu, you want to address what providers are being told?
Yes. Yes. So a couple of things. Number one, I'm not a pediatrician, but my guess is that the two good recommendations that come from here, number one is not to use homemade products, and number two really is to talk to your healthcare providers, talk to your pediatricians. Formula is so individualized that it's hard to make a blanket statement. If you can't use this, these are three other options you can use, because it's so individualized. It's almost it's a personal interaction between the mom, the baby, and the mom and the pediatricians about the baby, and each baby is a little different. So.
Especially with the specialty formulas, that's absolutely true and can be difficult to find. 98% of the formula consumed in the United States is made in the United States, and when one of the major manufacturers is offline with production, that's obviously going to impact supply and availability. So the good news is Abbott is going to be back up again, but it's going to be 8 to 10 weeks. So there's a lot of work from government, national, state, local efforts to really try to connect families with formula as much as possible. The stores are doing the best they can with what they have. It's just a very, very difficult situation.
And, I was happy to see that there's limits on, how many people can buy, so they're not cleaning off the shelves and hoarding those.
The panic buying.
We move through.
And initially, too, it didn't start off so well. When the voluntary recall occurred in February, some families panicked and threw out all their formula, even though it wasn't on the list. And then they went to the store to buy new formula, and the formula wasn't there. So it started off not well in February with families that actually had formula that was fine, that now didn't have formula and were trying to find it.
So I'm on the Healthy Children website, and I don't see anything related to this. So
HealthyChildren.org?
Yeah, I don't see
I was on it yesterday.
I just looked it up as well. If you go again, there's a lot of information.
Yeah, there really is. They talk about goat's milk for after age 1. There's really specific information in there for things that people can safely do for their children.
Okay, I was saying if the average person, I consider myself an average person, but I'm trying to find it.
Well, so Commissioner Gonzalez, I hear what you're saying, and also General Briggs, just related to the proactivity and us being persistent with this. We will continue to work with the State Health Department and press forward with some of this, and then we'll review what is on the healthychildren.org, also what is linked to on our website, and try to increase that information as we can, and not just on a passive website, but we're actively trying to be involved. And I knew that this would be of interest to you, because you can't always believe what you're seeing here and reading. And as you brought up, Commissioner Gonzalez, and I think it's important that this is our direction. And I think Dr. Vu's comments were really important, that having that relationship with your provider is so important, because there are so many situations within public health and direct service that are individualized.
That sounds good. Sounds like we're going to push information and not make people go look for it.
Yes.
So that'd be terrific.
And
Any
very
other
actively
comments or
working with our
questions?
WIC clients.
Yeah.
Thanks for the presentation, Brenda. What percentage of women breastfeed in the United States now?
I am happy to get that number for you.
Okay. I'll look at that one. Do we, and maybe you kind of addressed this, Susan, do we have someone go out and check the stores so that we can pass that information on, like, hey, where is the formula available?
With our WIC clients, we're able to see where formula is being purchased, so we can see what stock looks like. So if we receive a request from one of our clients, we can say, this store right now has this product. That store may not have that product the next day, but we can help people with as timely an information as we're able to obtain. And then some stores are open to people calling to find out what they have in stock at that moment, which is helpful because, again, a formula that might be available one day may not be available the next day. Okay. It may be a different type of formula that's available the next day.
And then relactation, what is that?
Relactation is actually kind of what it sounds like. It's allowing someone to produce breast milk. And so it does take some time to be able to do that. Our WIC registered dietitians can assist someone if that's something they're interested in doing. They actually have been able to do it successfully in cases even with a foster parent who had not previously produced breast milk for that child, even within a previous few months. So it is something that some folks are interested in and can be an option for some people.
You mean like for a woman who did not just have a baby?
Mm-hmm. Yeah.
Okay, I get it now.
Yeah.
This shortage has been going on for just a couple of weeks now, right? Is that right?
It started in February, and then it's been this cascading problem. It's gotten worse.
Is there an increase in breastfeeding now? Is this kind of an impetus for more and more women to start breastfeeding?
One might conclude that this would be a good time to do that. Certainly our WIC program and Nurse Family Partnership have always strongly encouraged and facilitated breastfeeding initiation and then maintaining breastfeeding. Sometimes as an infant gets a little older, women may choose to supplement with formula. Sure, and so in some of those cases, the women are now we're issuing the hospital grade breast pumps to try to help them produce more breast milk. But in some cases, she may not be able to do that. She might be working or what have you. So just really trying to tailor our response to what individual needs might be.
But you're not aware of a national report or survey that says, you know what, actually, the percentage has gone up 10% in women breastfeeding or anything like that. Okay, thanks.
Sure, thank you. Other questions about this topic before we move on to the Wic Mobile Services?
Go ahead.
Ready? Mm-hmm. Okay, thank you. Wic Mobile Services, this is something we have been wanting to do for a very long time. We have 3 WIC clinics. One is here in this building. The other one is in Southeast Colorado Springs, and the other is in Southeast El Paso County. Those latter 2 clinics were purposely selected for location because those are areas of higher health and economic disparities. In addition to those 3, however, sometimes families have other barriers that they're just not able to get to a clinic. The last 2 years, we have provided WIC services via telehealth, phone or video conferencing, and that's been helpful. We've actually seen some folks that found that quite beneficial, and now providing mobile services is going out to where they are. So if they have transportation barriers or other kinds of factors, they are more likely to be able to enroll in WIC and benefit from that. So we started in March. We send out a bilingual educator out to some of our partner organizations who serve similar populations as we do. Catholic Charities, Hillside Community Center, CPCD Head Start, Fort Carson, and Tri-Lakes Cares. We're also working with 3 additional partners, Lutheran Family Services, Refugee and Asylee programs, the Family Promise Shelter, which is a shelter for families, and Calhan Community Outreach. That area of the county doesn't always have as many resources. We've had some early success stories up north. Our educator enrolled a mom who had recently moved to Colorado. She was pregnant and had 2 small children and was homeless. She was at this other organization to get a food box, and we were able to enroll her on the spot. So she may not have been able to get into one of our offices or even be able to have enough minutes on a phone to be able to do a phone intake. So it was wonderful to be able to enroll her immediately. We also enrolled a single dad with 3 children when we were out at one of the other locations at Catholic Charities. So we're starting to see some early successes. We're starting to enroll people into WIC, and then they can receive their ongoing services at these locations as well in the county. And also trying to enroll families with infants in the NICU mobile, so they don't have to come into a clinic to enroll, to try to remove as many barriers as we possibly can. And they're eligible for all of the services, the educator, the registered dietitian if there's a high-risk case, and then also the breastfeeding peer counselor program, breast pumps, all of the benefits from WIC they can access mobile. Any questions about that program?
Questions?
I would just like to add that, as our county continues to grow in population, and we're very vast. I mean, we've been very intentional about how we're trying to meet people where they are. One of the aspects was the purchase of the Public Health South building in the city of Fountain, because we've grown over 100,000 people over the last decade in that area. So this is another effort that we are trying to meet people where they are, and I think that that's very important, because there are certain criteria that that the clients have to meet. But the earlier that we can be of assistance, train some taste buds and healthy eating and active living and those kinds of things, I think that those will have long-term impact. So I'm really appreciative of the efforts and that this is coming together. And I don't know, some of you that have been on the board for a while, this was one of the major passions for Vicki Browerman in trying to bring services to Fort Carson. So finally, after so many years, we've been able to bring it together. So thank you.
Thank you.
Let's go ahead and go into an opioid and fentanyl update. Every board meeting, we have been providing some updates, and we will continue to do so. So with that, Dr. Urbina.
Thank you, Director Whelan. Great to see everybody today. I'm just going to talk briefly about the highlights. I just wanted to remind you that Heather is here to answer specific questions about what we're doing with our community partners, as well as Fadi's here to talk about the data sources of things that we're looking at specifically. So, as we talked about in previous meetings, we're continuing to work across our partnerships in multi-sector. We are not alone in tackling this issue. I think everybody knows that it takes really a total village. A lot of people have been working on this and will continue to work on it. Our focus is going to be primarily education. We're focusing on the prevention strategies, as Commissioner Ralston alluded to multiple times. It really is, we're trying to get upstream, to focus on education, particularly among our youth, to try to focus on getting people not started on opioids, and again, of course, they're not exposed to fentanyl. We're working we have lots of information on our website, both in English and Spanish. People want to access it, although there's lots of stuff in the local and national media. As I alluded to earlier, Fadi is working with our partners, particularly CDPHE, and continuing to work with our coroners so that we'll have real-time or more local data as we go forward. It's still an issue, but broadly defined as overdose, including fentanyl as well. And finally, we've finally hired our behavioral health planner, is that correct, Heather? To work with our community partners to assess and evaluate resources, services, and gaps. So we're moving ahead. We haven't solved the problem yet, but we would be open to questions about where we are today in terms of the work we're ongoing with our partners.
Questions for Dr. Urbina?
I would like to just reiterate what I said about the behavioral health planner, I guess a month or so ago, that we hired a teen suicide prevention planner when the city of Colorado Springs and El Paso County was put on the map related to having a high teen suicide rate, and it was with Palo Alto, California, and Fairfax, Virginia, and that's not really a list that you want to be on, but how we responded is hiring a teen suicide prevention planner, working with community partners, convening them, and then creating action plans and moving forward with that. And that is going to be the same concept with our behavioral health planner in the realm of substance use and misuse, and focusing on youth, the youth population, and then also we're focused in on with other community partnerships with the community. the community continuum of care, and that is with the sheriff's office. So many of these efforts are going to get a boost of, I guess, refocusing as well, because with the pandemic, a lot of folks were reassigned to COVID responsibilities, and this is part of just transitioning into other areas of public health.
Thank you.
Okay, hi everybody. I'll be giving a very brief COVID update regarding latest trends and what has changed since our last meeting. Last month's meeting, we included a map from the CDC where different communities in the U.S. are designated as low, medium, or high. At that point, only 2% of the communities in the U.S. were designated as high, representing their caseload. Yesterday, the number jumps up to 9%, but I urge you to keep in mind the context of these numbers as you look at COVID data. The majority of the country, 75% or higher, are still considered low. The country in general is still doing well. So whenever you see last month 2%, this month 9%, I urge you just to look at the whole picture and to consider the comparisons that we're throwing out there rather than just the percentage and the change in percentage. Locally, the variants remain largely unchanged since our last meeting. Sadly, the CDPHE data lags a little bit farther behind the CDC data. The BA2 and the BA2.12.1 strain remain the dominant. We're starting to see BA4 and BA5, but it hasn't yet overtaken the other major variants. From the literature and what we're seeing nationally and internationally, there's some conversation about the new variants eluding protection you gain from an infection or vaccination, especially over time. But honestly, there's not enough time yet to establish that as a pattern, to establish that as a fact. We typically rely on the UK to look at their genome sequencing and look at what the difference between the variants are. Right now, those two strains luckily will increase in percentage. This is what's happened since the beginning of the pandemic. Variants come in, they displace the previous variants, and we learn more about them. In terms of our cases in May, we did have more cases, and the month is not over yet compared to April and March. We had about the same amount of hospitalizations in May than we did in the entire month of March. The good news is that we've only had 1 death so far in May, compared to 7 in April and 18 in March. Death data and hospitalization data, of course, lags, so those are not final numbers. But again, I urge you to keep in context and frame the numbers that you see in comparison. If I told you that May had twice as many number of cases as April and March, that may lead to conclusions that may not be accurate. Case numbers right now are heavily limited by unreported or undetected cases. So even though we are seeing more cases, it is something to watch. We like to watch the patterns and a plethora of clues that enable us to make judgments about the current spread in the community. It's important to note that whenever we talk about these numbers, we put it into context. Which month are we comparing? Did the case detection rates impact by other factors? That's it for me.
Okay,
Yes,
just
sir.
one question. Dr. Urbina, do you know how many cases of flu we had in May? Do we track that one? Just influenza.
The flu typically is tracked by hospitalization visits, not cases.
Do you know how many hospitalizations that we had then?
That's available
In
on our
May.
website, and I believe it's updated.
Michelle's looking at it right now. We have that.
And
I don't have it offhand.
and deaths.
Again, it's hospitalization.
Sure. Sure.
Sometimes it's very.
Yeah. Of course.
Hospitalization. Probably related to our masking and prevention strategies. COVID.
Mm-hmm.
Retroactively.
Okay. I don't want to hold you up.
I do want to say that, at some point, I don't know what the time frame would be, that COVID would be treated related to a reportable disease as hospitalizations rather than all of the positive tests. I know flu used to count every positive test, and I think that was back in, 2011, and then it transitioned to being a reportable disease that for hospitalizations and pediatric deaths. But that's something that we're monitoring, and we don't make those decisions. That is decided at the state. But I did want to say that that's something that we're closely looking towards, and then also pandemic, and then when is it classified as endemic, and we don't make those decisions, but those are some things that we're tracking.
Yeah, I just thought it'd be interesting to see if flu actually, you have it? Okay, so it's actually hospitalized more people than COVID has. Thanks.
Can I offer one interpretation of this? So even though hospitalization and death lag behind, if the trend is true, and I think it's promising, as cases increase, mortality rate continues to decrease.
Yeah, generally it's sort of a elastic band analogy. If cases go one way, hospitalizations and deaths will follow, even if the number of cases is very limited to interpretation based on the unreported or undetected. But if it's a limited metric, but it's increasing over time, it's still worthy to look at it and look how the hospitalizations and deaths will follow.
While Buddy's still up there, can we hear about monkeypox? Can we shift a
We're
little
going to
bit?
get into that in just a bit. I want to kind of keep with the theme of the COVID response and just let you all know that there's a recognition that we received by the National Association of Counties. It's NACO, and Commissioner Bremer, I know, is a member, as well as Commissioner Gonzalez. Are going to have a conference here coming up in Adams County in July. And El Paso County Public Health will be recognized for the development and the response by our vaccine consortium. And many of you on the board were involved in this effort. Dr. Vu, I know when you weren't a board member, you were involved in the vaccine consortium. And Fire Chief Ted Colas was involved when he was also still working with the city of Colorado Springs. And the Mayor Southers made every single meeting. Dr. Terbush, I know that you were heavily involved. Our hospital CEOs, our medical directors from our all of the hospitals, Children's Hospital, UC Health, as well as Penrose St. Francis, our Pikes Peak Office of Emergency Management. It was a vast group that we had convened to response in response to COVID, and offering easy access to vaccines where people are, mobile vaccines, and education, through multiple modes. We did a GPS map where people could type in their zip code and then find vaccine nearest to them. So this is something that I think is outstanding and speaks well to our community. And I think General Briggs said it earlier, that we are a community that works well together, regardless of whatever the situation is. And this is an example of that. And we have a lot of team members who were integral in planning for the vaccine receipt and supplies and getting it out to providers. And that was not a smooth process either, if you all remember, that there were some bumps along the way. But I'm just thrilled that we're going to receive a national award on this effort. So kudos to staff and everyone that was involved in Board of Health for supporting the effort. Now we can move on to monkeypox. I think it's always important. There's so much going on in the news and so much that is written. Sometimes there are pieces that are left out, and sometimes there are things that are said that may not be factual, and that we have an agency also when it comes to diseases that we do monitor closely with our partners, and we want to provide some direct communication around what we're seeing and what we think is important, because you say monkeypox and you show those images, it can be quite scary, and I think that we need to bring it down into perspective related to what it means to our community. So Dr. Urbina, please help us to understand.
Thank you, Director Whelan. Oftentimes, and I think I want to emphasize this and the importance of El Paso County and the direct surveillance team that we have here. We have an excellent epi team. I think they stay abreast of not only the national but the statewide data. And this is two examples that we are constantly monitoring. And I know they're in the national news a lot, so I think we wanted to just talk about it today with all of you, to see if you had questions. I am not an expert in monkeypox. I would guess there are very few in the world that are experts in monkeypox. Monkeypox is an old disease, probably first discovered in the 50s, related to an exposure in West Africa. This is a disease primarily connected with probably small rodents that again spread to human populations, and ultimately it was shown in monkeys, and therefore it became the name of monkeypox. But it's an old disease. It's related to smallpox, if you remember. We had smallpox all over the world. Now we don't have smallpox anywhere in the world, largely related to vaccination and stop the spread. But they're closely related. We also have cowpox. It became national news because we had a case that was non-exposed in West Africa, somebody who was exposed in Canada, who then came to Massachusetts. And then the national surveillance team kicked in, and it started to identify additional cases of monkeypox. A health alert went out to all physicians and health providers across the country. Again, just like we do with any other condition, communicable disease, we try to raise people's awareness of a disease so that they can start looking for it. And that's why you see much of the national attention. It's related to informing health providers and informing consumers or people that if they have been exposed or have come up with the following symptoms, they should be checked. And the test is a very simple test. If you've seen some of the pictures they show on national news, it looks like, many ways, chickenpox. Although it's not the same pox, it's similar in the sense that you can scrape the lesions and do a specific, either grow the virus or actually do a PCR test. So that's why we're encouraging people to become aware of it. It's fortunately a very self-limiting disease. There's no specific treatment. There are immunizations against monkeypox, but at this point, it's not for the general public. So the importance of why I want to bring it up today is that it's a rare disease. We want you to know that we are constantly in surveillance and working with our folk partners at the state level to make sure that if we have to initiate something, we'll be adequately prepared for it. So I'm going to stop there and see if there are any questions about monkeypox.
Yes,
Dr.
please.
I really don't know anything about monkeypox, but can I ask you, is it still in the same family as herpes virus?
Good question. No, it isn't. It's an orthopox, separate type of species. Okay. But herpes, vesicular lesion, syphilis, and other infectious disease can be mistaken for it.
Okay.
So I think you're asking a great question because, as you always do, as a clinician, you start thinking about, all right, what else do I need to worry about? In addition to syphilis, herpes simplex, and other diseases cause vesicular bullous lesions like this. So that's why we're, but not the same family.
Thank you.
And what reassuring is that we have plenty of vaccine against monkeypox.
Correct. We have vaccines against monkeypox, and we have vaccines against smallpox as well. So,
right.
So anybody who's working with those animals or working in that population can be vaccinated to actually prevent the disease.
Yep.
Dr. Turbers.
Oh, yes, please.
I thought, how many cases have there been in the United States, Dr. Rubina?
There's one reported case, and there are 4 or 5 that are currently under investigation. So it's an extremely rare disease.
Anything west of the Mississippi?
I can't tell
Probably
you that.
not.
There are actually at least one case that I know is being investigated in California. Not surprising.
Okay. None in Colorado.
No cases in Colorado.
Thanks.
And how deadly is this disease, or is it just like getting chickenpox?
A great question. It's generally it has to do with the immune protective strength of the individual. Generally, it's a self-limited disease. People recover within weeks, but it certainly causes lots of irritation and damage. But it's not usually life-threatening.
All right.
Let's move on to hepatitis.
Great. Now another sexy disease here. You all know about hepatitis A, B, and C, and other types of hepatitis. This is a very unusual hepatitis that's been reported in association with an adenovirus. Adenoviruses are generally respiratory viruses or gastrointestinal viruses. So in this case, in last fall, there was a series of reported cases in Alabama or in the southern states where they saw 9 unusual cases of kids who had liver failure. A couple needed liver transplants, and a couple were very severe, so that they actually were hospitalized with disease. All have recovered, but it was a very severe disease. So again, CDC in the states set up their surveillance tools and said, are there other cases like this? And so we created this surveillance key, and we found 13 cases in Colorado. All have recovered so far. We may see future cases in the future, but there have been none in El Paso County. Now, the question you should be asking is this a serious problem? I think from a clinical standpoint, yeah, of course it is. If you are somebody who gets infected with a adenovirus, and it's a common virus in our community, and you come down with liver hepatitis type features, you should definitely go and see your provider and get a diagnosis. But because this is still a rare phenomenon, we're tracking it very, very carefully and trying again inform our health providers to test for it. It's not something that's vaccine preventable. It may be in the future, but at this point, it's not. And this is all we know about this current disease. And again, as we did 2 years ago in March of 2020, when we talked about COVID, there were a lot of unanswered questions. And that's part of our dilemma, is that when we see a new communicable disease or old communicable disease like monkeypox, we want to talk to the patients, do a case report, learn more about the situation, and then spread out information about how to prevent and diagnose these conditions. And so I just wanted to give you an update on that. Any questions?
Thank you.
I'm not seeing any questions, so thank you, Dr. Urbina.
Sure.
And Michelle, if you'd like to come up, we have published our 2021 annual report, and I commend Michelle's office and the content contributors, in the thick of COVID, trying to put some information together on accomplishments and budget information for 2021.
Thank you, Susan. And I'd like to thank the whole comms team and the entire agency. This is really a team effort to pull together all of these accomplishments and highlights. So this is available on our website, and we'll also make hard copies available for each of you. So you'll see a wide variety of work captured in the past year. So as Susan had mentioned, some of the accomplishments of the Vaccine Consortium and of all of our community partners, we know that as a community, we made tremendous strides with COVID, administering more than 1 million vaccine doses throughout our community for those who wanted to receive one. Also more than 1 million PCR tests completed, with nearly 30,000 of those being completed at our own Public Health South location, which was truly a powerhouse of activity over the past year. And also advocating for treatment and therapeutics in our region. We were prioritized in El Paso County with one of the first monoclonal antibody treatment buses from the state, and were able to administer about 500 doses of life-saving treatment to individuals in our community. 2021 also saw really re-engaging in a lot of our key agency priority areas, so healthy eating, active living, mental health, substance use. So you'll see a snapshot, a lot of those highlights. We continue to serve about 13,000 clients a month through our Women, Infants, and Children program, with a lot of money through that program being redeemed in local grocery stores. We also, one of the things that is really important to reflect on is some of the incredible work of our environmental health team. Despite the hardship of the pandemic, we have more retail food establishments than we have at any point, with more than 2,800. Our on-site wastewater treatment system continues to see growth. We've got a lot of new construction, new homes, particularly in the eastern portion of the county. So the team has worked really hard to be able to not only provide the services that those homes need, but also improve the customer experience, reducing turnaround times, streamlining those processes. So invite you all to review that report online. There's a lot of really great accomplishments. You'll see all of our individual and agency awards and accolades. We have more detailed information on our budget and all of our programmatic work. So just a lot of teamwork with everyone throughout the agency coming together. And even in a 36-page document, it still is just a snapshot of the incredible work of our entire agency. So invite you to review that, and we'll make hard copies available as well. Thank you.
Thank you, Michelle. That's all we have.
Okay, well, great. Any safe grounds? Any final comments from board members? Or if not, I'd entertain a motion to adjourn.
A motion.
And seconded.
All in favor?
Aye.
Okay. And next month is, what, the 22nd of June?
22nd, June 22nd.
When you say we normally have a slide. There it is. Okay. We'll see you then. Thank you very much. Thanks for all the great presentations.
And no meeting in July,
No meeting in July. And next meeting is going to be in a different room, but
the 19th.
nearby, adjacent. Okay.
Vicki will